talk about antenatal care from conception, onset of labor. Kevin,
iko sawa. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 10, 5, 6, 7. Are we ready? Link.
by the way, I was happy. I saw all of them were very cute.
Okay, indeed it is Wednesday once again, and on the Morning Glory Show, whenever it is Wednesday, then it is a healthy, wealthy, wise Wednesday. Good morning to you, where you tuned in from. Ingia pale kwa comment section, niambie unanitizama kutoka wapi. As always, I've always promised you that I'll sample your comments, so I'll make sure that tunapitia comments za kila mtu. But then first, ingia pale ndani ya comment section, tell me where you tuned in from, and then also if you're getting me clearly. Remember that every time you tune in and tag your friends, then you have a chance to win a cake courtesy of Redroyal Cake House. Tafadhali ingia pale ndani, tuchangamke, tusalamiane, uniambie unanisikiza kutoka wapi. And by the way, hit the like button, because whenever you hit the like button, I'm able to know that actually you are inside the broadcast. So hit the like button, gonga your button, karibisha rafiki, tag as many friends as possible, and at the end of this particular broadcast, somebody will walk away with a cake courtesy of Redroyal Cake House. Tusalamiane, tujuliane hali. Kama watch topics za last week, actually last week we were talking about contraception, and for the whole of this month, doctors and experts from IVC Milimani Hospital, that is in Eldoret, will be coming to the show to talk about reproductive health. So we started with I think the other week we discussed fertility, last week we discussed contraception, and today we are going to talk about pregnancy. I'm sure they'll have, the experts will have better terms to use, but then for the purpose of our understanding, then it's just pregnancy, right from conception until when the labor pains begin. So make sure that you're in with us. Let's engage, let's talk to each other, let's learn from each other. Before I go far, allow me to introduce my guests. I think I'll start with Salome. Introduce yourself once again, because you've been here before, but then there are those fans who may not actually know you. So introduce yourself and then tell us a little bit about yourself.
Good morning, everyone. I'm back to continue with our education on reproductive health. And today, we are going to see what happens from conception to last week of delivery. Previously we talked of how to prevent a pregnancy by using certain methods. But now today we are imagining you have now accepted to be pregnant. So from today we are looking at it as now each of us who listened to the previous lesson, we talked about family planning. Now today you are pregnant. A pregnancy, definition of a pregnancy is where a woman conceives a baby after they have had intimate with a male fertile person. So you conceive, and the first sign, we as a woman, we come to confirm that you are pregnant. The first sign we realize is loss of our monthly periods, that is menses. After that, there are some few signs a woman may feel. Others may not feel anything. For example, loss of appetite. Some might have tendency of vomiting. Some may have epigastric disturbance. Yani tumbo kusumbua kidogo pale juu kama ni acid. Others may feel like they are weak. They are weak, they cannot do their daily activities well. Once you have realized few signs like that, you report to a clinician to confirm for you, would you be expectant? Are you pregnant? So if there's any question of maybe not pregnancy, maybe something else has happened, we do a test. We call it pregnancy test, to confirm that you are pregnant. Okay,
I think we'll take it up from there. Rightly, she's actually set the tone for the conversation, but we'd also like to give Kevin, who is also an expert from IVC Milimani, a chance to introduce himself. Then we'll go back to Salome now to actually continue with the introduction of today's topic. So karibu sana Kevin, salamia mashabiki.
Asante sana. Wacha nichukue muda bado sema majina yangu ni Kevin Kibore. I'm a clinician at IVC Milimani Hospital. And just like we have been doing this series for the last 2 weeks, we have just been dealing with issues of reproduction, and we are ready to journey with everyone who has an experience or has had a shot at getting a challenge that revolves around reproduction. So we are ready. We are ready to journey with clients who have issues with reproduction, and even today we are ready to journey with those who are already expectant and now they need what we call antenatal care. Thank you very much.
Okay, thank you so much. Just to read some of your comments before turudi pale kwa Salome aendelee kutueleza. Actually, this conversation is set in a way, I think it is in the public knowledge that pregnancy is divided into trimesters. And so this conversation will tackle each trimester separately. So we will look at what you expect from maybe the changes that a mother undergoes in the first trimester. We will also try to look at the challenges that may come up during the first trimester. We'll also be able to look at how to mitigate then those challenges that come with the first trimester. After that, we'll go to the second trimester, third trimester, but then at the end of it all also, we'll be checking your questions and making sure that at the end of it all, we are able to answer them. Just to read a few of your comments, there's somebody called Bishop Owen Kiptoa. Actually, Bishop asante sana, he's been very consistent on the show. Bishop keki sio mbali na wewe sana. Remember that I said Redroyal Cake House kila siku wanatupea keki ya kukupatia wewe wakati unachangia mjadala. There is Hustler Nation TV. Thank you so much. I think pia nao amekuwa nasi muda mrefu. Anasema good morning world. Good morning to you. Bishop alikuwa amesema tuned in from West Indies. Okay. I hope ni West Indies ya Kenya ndio keki iweze kukufikia. Okay. There is somebody called Mildred Sue. Mildred, asante sana, anasema tuned in. Kims Lavin, good morning to you. Ameamsha Kims Lavin. Kims Lavin changamka bana. Ingia hapa ndani. Actually, yeye ndiye alikuwa mshindi wetu wa keki jana. Tirop Felix Kiprop anasema good morning, tuned in kama kawaida. Thank you so much. Ameamsha Boni Kim. Watu waamke tafadhali tuweze ku have this conversation. Kims Lavin ashaamka anasema good morning, tuned in from Moso, getting you loud and clear. Yes, tag more friends, bring them, let's have this particular conversation. Tirop Felix anasema nakusikia loud and clear. Thank you so much. Boni Kim saying good morning, watching from Kapsabet. Kevin Otieno, thank you so much Kevin. Kevin is saying good morning Kevo, hapa watching from Eldoret, hope to get enlightened. By the way, you'll get enlightened. Na hii homa by the way, na hapa tuko na madaktari. Nimekuwa nayo kama wiki mbili kifuatana. Siamoni kama hapo kuna issue. Anyway, there is Redroyal Cake House. Wako ndani. Sasa si wakasirika hata watuongeze keki moja basi. So thank you so much Redroyal Cake House kwa kuwa nasi siku ya leo. There is somebody called Nedi Jeruta all the way from Elgeyo Marakwet watching. Thank you so much Nedi Jeruta Kiptoa for always being with us. Tirop Felix Kiprotich, thank you. I think Ansema this will be a nice topic for us who are about to start families soon. Yeah, it's true. If you are planning to maybe start a family soon, the only way to start a family actually is to just get somebody, get them pregnant. Of course, but then the church would say take them to peleke kanisa kwanza mfanye harusi, but then I'm sure the doctor will just say as long as the man and the woman are very fertile, then we jump into it and start making a family. So if you're planning to make anyone pregnant soon, or you're planning to get pregnant soon, then please, this is the right show for you. Kevin Otieno once again saying anasema good morning Salome, happy to see you again. I'm a Catholic and very proud how you introduced the natural planning methods. God bless you and God bless the morning glory. Thank you so much. Bethuel Kiplagat Bet, actually nimemwona pia amekuwa na sisi, karibu sana. We would want people to kuja hivyo naanze kuwa consistent hivyo and actually keki haichezi mbali na wewe sana. So karibu sana, anasema morning tuned in from Nandi County. Thank you so much. There's somebody called wow, you'll forgive me for that. I'm sorry that kozi inanilemea kiasi, but I'm sure you'll be able to pull through. So I think because of that, I'll maybe have to stop to reading the comments for a minute and welcome Salome to just set the tone for the conversation. Karibu sana.
Thank you. Welcome again. I'm happy quite a number of you are listening and watching what is going on. As Andy said there before, we are tackling today management of a pregnant mother, and what will make us have a knowledge that a woman is pregnant I've said it is the first sign a woman will report will be lack of menses, lack of monthly period. Once you have had that first sign, you may feel some signs of vomiting, some signs of loss of appetite, we call it nausea, especially morning hours. And then thereafter, if you want a clarification, we can do a pregnancy test for confirmatory. So a pregnancy, we divide it into 3 phases, if I may call them phases, or trimesters. Why divided into 3 is because during growth, our pregnancy is just like a shamba where you plow land. First you prepare, then there's a time for planting, there's a time for weeding, there's a time for spraying, and there's a time for harvesting. So it is the same. That's why we have the 3 trimesters, and I'll start with the first one, and we'll tackle the complications or the issues which come up within the first trimester. After confirmatory that a woman is pregnant, we start an antenatal clinic immediately. And I have my tools here. Which we use during antenatal care. We have a book here. It has a nice title here. It is a government guideline where we feel if a woman follows all what is here, we shall be able to care for her baby and herself till delivery time. We have another gadget here. This one is called a fetoscope. It helps us to care for the baby's heart. Is it beating? Is it not beating? We need also to do, that is on the first day of visiting the clinic. We shall also need to do blood pressure. So these 3 gadgets plus weighing machine to take weight, which I do not have with me, they are the most important things to be done during antenatal care. So once we have confirmed you are pregnant, first day of the visit, we do what we call an antenatal profile. An antenatal profile is where we check quite a number of tests so that if the woman is sick, may be treated early, because those complications, they can bring complications to this fetus this mother is carrying. One of them, we measure the hemoglobin level, that is HB. We want to see in the antenatal profile, HB is important because we want to know the amount of red blood cells within your blood stream so that we are sure this baby will feed well. It's just like you have to put some manure in the shamba so that when this seed has grown, may be able to feed well. So with a woman, we also make sure the uterus and the blood is well supplied by checking the HB. And this hemoglobin level is also very important when it will come to delivery. It will also help us to, this mother not to get a low birth weight baby. A low birth weight baby is 2.5, 2.4 and below. That means the baby has not fed well. So hemoglobin level is one of the most important profile test we do. We also do blood group so that we exclude the rhesus factor. If the mother is rhesus negative and the father is rhesus positive, this baby who is carried by this mother might be in danger. So every time we must check the blood group of this mother. The other very important test we also do.
Okay, maybe just to interrupt you before you go there. So many people also ask that thing about the blood group and how it can affect the baby. I think after you finished mentioning that, we'll give a chance to Kevin to take us through that. Okay, thank you.
We also need, thank you, we also need to do some tests in urine, because sometimes women, we have a quiet type of infection, and once a woman has got pregnant, there's always low immunity in the body. So feeding well and checking the urine is very important, just to confirm that she is not infected, because if there's infection within our birth canal, it can affect the pregnancy. How? The bacteria can go up and break the waters, and you can get an abortion. So it is mandatory for every woman to do the urinalysis to check that the woman is not having any infection, whether has symptoms of infection or not. The blood group has to be done. Another important antenatal profile, that is done always. First visit when a woman comes will be syphilis. We call it VDLR. If a mother turns positive, there is treatment for it. My clinician here, my colleague, will talk about it, how we treat. Why test for syphilis? Mothers who get infection of syphilis, it is very likely that either the child will be born with very bad complications, deformities. Sometimes they can have even maybe no one eye is not good. There are so many organs in some organs to the baby which will have defects. The other thing about syphilis is mostly the babies die in the uterus, and we remove them. We say that a mother has IUFD, intrauterine fetal death. That's why it is very important for every woman in every pregnancy to do the test. The other test is HIV. Of late, not very many years ago, although it is like it's fading now, we are getting used to it, is HIV. HIV, also my colleague will talk more about it, why it is important to treat. We do it so that this baby may not turn positive if the mother is HIV positive, and if the father is also HIV positive, there is management during antenatal care, so that we make sure this baby being carried by this mother does not get infection of HIV virus. We also give an injection called tetanus toxoid. Why give TT? Tetanus toxoid, when the baby is born, we term the cord clamp to be a wound. It's like when you are cut, generally, you go and you are given a TT. So this cord of this baby can infect the child and gets tetanus. So we have to give mother first pregnancy, 2 injections of tetanus, and this will be synthesized by her body, and then it will create immunity inside the baby before it is born. So there are also others tests can be done, like blood sugar. But the main, even at a health center, is the ones I've mentioned. We need to do sugars. Sugars we want to exclude diabetes, because diabetes is also another condition which can make a mother to have a very big baby, and she will not be able to give birth normally. She might need elective cesarean section now that the baby is big, because of the sugars has been accumulating in the mother's blood. So they tend to have very big babies. Others might not develop well, because this mama is using, controlling her sugars with some drugs. for diabetes. So we have to be careful with any condition like diabetes. My colleague will talk about it kidogo. And then body weight. Body weight, why do we take it? We take body weight because there are some mothers who will either reduce the weight so much or others will go too much, and we have to help them understand the maintenance of weight. If the weight goes so down, the baby will not get enough feeding before term. All that is done in first trimester. Blood pressure, as I showed the gadget here, most of us we know it, tumeiona kila mahali, ni mashini muhimu sana. Kwa nini? Pressure ya mama, if the pressure goes up, it makes the baby to be in danger, because there is a force from the heart of the mother, and this force will also affect the flow, the pressure on the placenta to the mother, and that endangers the baby. The commonest and the most dangerous effect of high blood pressure in pregnancy is a condition we call preeclampsia, whereby a mother presents with fits, anakonifasi kama mtu akivava. I'm sure maybe a few of us, even at villages, we have observed some mothers having fits while pregnant. That is a very serious effect on a pregnancy, and that is why blood pressure must be taken on every visit. And also the mama has to care for herself. If there's any sign of swelling, especially there's edema on the feet, and the pressure is up, we test urine, we find it has some protein. Those three signs will help us know this lady might be developing preeclampsia. So we have to be very keen on that. All that is quite common in the first trimester. Any other condition, if the mama has, there are those who have got maybe diabetes, as I've said. There are others who have got asthma. There are others who are HIV positive, but they have to continue giving birth. We take them as special high risk. We call them high risk mothers because they need special attention apart from the general care. So first trimester ends at 3 months, and maybe that's where I can reach. I may request the clinician to continue giving the treatment of the complications of first trimester.
Okay, thank you so much. As we go back to now the clinician who is actually Kevin on this particular show to help us understand these particular conditions that come up in the first trimester. If you have any questions about the first trimester, then you'll be able to shoot them. A question that I've seen coming up so many times is about the blood group. So I think, Daktari, as you also mentioned, treatment of different conditions that will come up during the first trimester, also touch on the issue of blood group. Yeah. Karibu.
Thank you very much. Just like you've heard, today we are journeying with the mothers, and we are looking at the first phase or the first months of pregnancy, and we call it the first trimester. This is about the first 3 months of pregnancy. During that phase, we are expecting that the fertilization and implantation journey was well, that the sperm traveled well until where the ova was. It was successfully fertilized, and then the journey of the ova traveling back to be implanted into the uterus has been successful. Why am I mentioning that? It's because some of these complications that we want to talk about or we want to mention actually revolve around the journey of a fertilized egg back to be implanted into the uterus. So first, the fertilized egg has to be embedded into the uterus so that we can now have a successful growth of the fetus. So apparently, as we have had, once we have confirmed, during that journey, there are a few changes that are going to occur to the mother. During those changes, because now the body of the lady now wants to carry another human being. It means changes have to occur revolving around the reproductive area. functions have to change. Remember that uterus used to do a certain function every month during that other time that it was not pregnant. It was just doing its monthly sheds because of in case there is preparation. But now we have now got a fertilized ova. But now the uterus needs to take care of the fertilized seed. So if it has to do that, the preparation changes. So it means the hormonal circulation has to change. There are some hormones that have to step down and others to step up so that it can maintain the pregnancy. And as that happens, those hormones, as they grow in levels, they cause some changes in the lady, and especially in this particular trimester that we are talking about, so that they can foster this child. But as these hormones rise up and they try to foster the child or the environment of the child to grow into, or the fetus to grow into, then the woman also experiences some things. So the most common things we look at, just as we have said, is once those changes started to occur, once these changes start, the lady would want to find out what actually is happening. So a pregnant woman would first appear into the clinic as someone who's sick. So they would maybe present with, I don't have, I suffer from lack of appetite, I suffer from excessive vomiting, I'm weak and oftenly dizzy, you see. So you would want to find out. Then from your history, probably you'll discover that she has already missed maybe one session of her monthly episodes. So for me, it will quicken me just to do a pregnancy test, because I want to know, for every lady, it is common for us, when a lady visits us, we would want to find out when did she last see her visitors. So when she skips a month, then we know there's a possibility that she is expectant. So once she's there and we have confirmed that she's expectant, just like we have been told, that is when we qualify her. Once we do that test and we are looking at, we are ruling out issues of why she's having those episodes of weaknesses, vomiting, and we confirm that she's pregnant. That is now when we send that particular, just before even we address those many issues she's come up with, we send her for antenatal profiling, even from day 1, day 2, day 3, week 1. So long as we just confirm that that particular lady is now expectant, we now advise her to start her antenatal journey. And during that journey, we want to deal with risk factors. We want to make sure the passenger is okay, and the carrier of the cargo is also okay. So that is why we have talked about these tests, because when you are doing blood levels, we do not want this mother to go into anemia, because it would mean even the perfusion of the fetus is going to be bad, and the development of the baby is going to be risky. Why are we doing that urinalysis? You've been told that one of the dangers of birth defects, abnormal babies, is that they suffered intrauterine the mothers have suffered intrauterine infection. So we'd want to take care of those infections early, treat them, because it doesn't mean if you have it must affect the baby. No, you can be put on treatment, and we sort out that. Another complication that comes up, and we do not want it to affect that pregnancy in that first trimester, because it will lead to what we call an abortion, is that blood group incompatibility. Yes, for lack of a very uncomplicated term, we just have to call it incompatibility, meaning there is a struggle between the baby or the fetus and the mother concerning the blood group. That is why we want to find it very early. So there is what we call ABO, incompatibility. There is what we call Rhesus incompatibility. These things have to marry, because these cells actually trigger antibodies in the body. And when we cannot match up, when we cannot match up the antibodies, when we cannot match up the blood groups, then it means the mother will be fighting the fetus, or rather whatever the mother produces as antibodies will fight the pregnancy. And if that war becomes intense, it means then the body, since it's the woman who is carrying, and he feels that the fetus is a threat, then the antibodies will work against the pregnancy and make sure it is terminated and it is removed from the system. So for us to have that, when we discover there is that challenge, that is when we introduce treatment like anti-D, just to make sure that we take a hold of the mother's antibodies that would want to resist the baby because of the blood group, because their blood groups are not matching. So that is how we would want to take care of it. Now, there's a complication about, which I would love to mention right now. It's a common thing in between the journey of the fertilized egg and to be implanted into the uterus. Sometimes that journey stops somewhere, and the egg does not reach the uterus to be implanted there so that growth can happen. And the pregnancy starts growing at a wrong place. That is when we have what we call an ectopic pregnancy. Depending with how adverse it is or how aggressive it wants to grow. Some of it even disappears even just before we even get clinical signs and even treat, and the body takes care of it. But sometimes some of those pregnancies outside the uterus become very aggressive and they want to grow just like normal pregnancy. And for example, a pregnancy growing in the fallopian tubes does not have much of space and headroom to actually grow to maturity. So it means it will reach a time when the fallopian tubes will give in, and we'll have a rupture probably, and we'll have a surgical emergency. So why are we following up that pregnancy? And as we are going to go into maybe the next trimester, we are going to talk about that. We want even to find out the position of that pregnancy. Is because that we do not, an ectopic pregnancy is always an emergency, because it will appear between 6 to 8 weeks. Much more, maybe by the time it reaches about 12 weeks, that most of the time it doesn't reach that far, maybe 10 weeks. But at 6 to 8 weeks, you're expecting some pain, you're expecting maybe some bleeding, you're expecting some very sharp pains that come in intervals, and the woman is really complaining. And when we ask for investigations and we find out that the pregnancy is off. So even if it has not complicated that much, we would want to send that patient for surgery and remove that particular kind of pregnancy, because it has been implanted the wrong place and it cannot survive beyond where it is.
Okay, as you talk about that, actually, there's somebody who had asked if, does it mean that once ectopic pregnancy has occurred, or signs of it, then there is no any other treatment apart from the surgery?
Yes.
Okay. Okay, that was the question that had come up. Maybe I'll sample a few comments, then we shall head to Salome to take us to the next trimester. So allow me to read some of your comments. I've seen somebody, Queen Shi, saying good morning. Queen Shi ametag watu wachache hapo. Thank you so much Queen Shi. Kosgera Apchesir anasema come listen to this. Pia ametag a few people. Thank you so much. I think I also have somebody called let me just sample all the comments here. Vivian Cherop saying, is intimacy important during pregnancy? Okay, that's a Vivian Cherop's question. Then there's somebody called there are a lot of comments and a lot of conversations that I may not read. I'm just trying to get some that maybe the Daktari will need to reply to them. Super MC Kolo saying tuned in from Soy, thank you so much. Joshua Lele saying akondani kama ibada, thank you so much. There were Mildred Sum asking, does irregularity of periods a sign of infertility in women? Okay, we tackled that last week, but I'm sure you'll have something to speak to it. There is somebody called Bethwell Kiplagat Bet saying, okay, I think replying to that, but we really want to get the expert opinion about the issue of periods being irregular. Then there's Chepleting Berir saying intimacy during pregnancy is very important, but si lazima. Okay, Daktari, I think that is something that is coming up a lot. And then what are the signs of early pregnancy? And then somebody also is asking about Whether and some okay. Chipleting Birit says during pregnancy, most of expectant mothers are at risk of getting UTIs due to poor hygiene. Hygiene should be a key role in every trimester. But then at the same time, there's somebody also who's come inbox and ameuliza, is the UTIs due to poor hygiene? So you also maybe need to tackle that and understand why people get these particular UTIs. Then there's somebody called Gogo Small. Gogo Small, thank you so much. And I'm tuned in from Kaptagat. There is Kenrezi Rob, thank you so much for being here. Thank you so much. I think we have quite a number of questions. So the first one is rotating around UTIs, why people get them. Is it because of poor hygiene or because of what? And then there was also a question about irregular periods. I think Salome talked about it last week, but she'll also get a chance to say something about it. So maybe you can answer those questions, then take us to the second trimester.
Okay, I'll start with the irregular periods. Irregular periods are just caused by hormonal imbalances. Sometimes, as we talked last lesson, that we said about using hormonal contraceptives, if you misuse them, maybe you are like taking an emergency pill at any time. As we talked in the previous lesson, it can interrupt you with your normal way of hormonal production in your natural way. As we said in natural family planning, we use body signs, but not anything to make the ovum not to be released. So hormonal imbalance can appear, and that means you'll not get your periods regularly. Sometimes they can go to 30 days. Sometimes they can go even up to even 2 months. There are many women who don't have monthly period every month. So if it is scaring, we request you see a clinician. There's a way of trying to regulate the hormonal imbalance, plus good advice on your lifestyle. Probably there's something triggering that. Then if we come to UTI. UTI in pregnancy is common. I said in the first trimester that when a woman gets pregnant, there's always very low body immunity. Just because of the changes, my colleague here said that now that we are carrying a new person, and this person needs care, there should be changes, very many changes, so that it accommodates this new baby coming up. When we go to second trimester, we shall find that the weight of the baby grows, and sometimes it also fiddles with the organs at our lower uterus, which is the gallbladder, urinary bladder. This urinary bladder, because of the weight, sometimes we women, while pregnant, when we empty our bladder does not release the all urine at a go. So we also tend to retain urine for longer hours in the urinary bladder than any other person who was not pregnant. But the commonly reason why UTI is there is because of low, I may say the chemical changes during the first trimester, now that the body needs to accommodate what we expect for this baby to be. So urine might become more acidic. One poor in intake will also interfere, but as the months go up, the weight of the baby interferes with the pressing of the urinary bladder. So we find that our urine most of the time is retained for some hours. It is common to almost every woman in pregnancy. I will talk about signs. Somebody asked about how do I know whether I'm pregnant. We have tackled signs of pregnancy. The first one a woman will always report is, I've missed my menses. If the month of the menses has not reached, might start having some nausea. loss of appetite, feeling the body. They say, nasikia mwili si yangu. So they feel probably they are not well or they are sick. They'll go to the clinician, as he said. Most of them appear being sick. Na kumbe, you are in the first, maybe the first 2 weeks of pregnancy as you are waiting for your periods to come until that day reaches. So signs of pregnancies are many, but the only confirmatory factor we can do is doing the pregnancy test. All today we have the ultrasound machines almost everywhere, and the machine is able to capture a pregnancy of only 6 weeks. So once that is done, we might not continue, the clinician will not continue pumping you drugs. Maybe you have malaria. Most of them come with the signs of saying niko na malaria. We have to stop because drugs are very dangerous in the first semester. Now that it is the time the baby has started germinating. It's just like the way when you plant your shamba, you don't leave it. You don't leave chicken, people crossing by. In fact, your neighbor will be very harsh on you because if you step in, you will spoil the germinating seed. So the same we take care for a pregnant woman in the first trimester. We try as much as possible to give advice of over-counter drugs because of headache, nausea, the mother not to take unless it is through instruction of a clinician, because there are some dangers you cannot take in the first semester of a pregnancy. Yes, okay. They reach there.
That is quite brief. So that means that maybe, okay, I think you've now tackled the second trimester somehow.
Yeah, the first trimester.
The first trimester.
Yeah, maybe I may go maybe the second one.
You may now take us through the second one. Now, then maybe you can get the complications and what we make, the changes we may expect in the second trimester that are different from the first trimester.
There's nothing much in the second trimester. The only important thing to follow is if you have completed all what is expected in the first trimester, we now feel the shamba is growing well. We now only need to weed. How are we weeding? Our abdomen tends to have expanded. So we'll come to what we are calling today dress code. It is important for a mother to put on something which is not tight at her waistline. Because if you press the uterus while the baby is in, that uterus, the time of delivery comes, the contractions, the onset of labor might disturb because you did not give enough space for this uterus to expand. The muscles of our uterus has some expansion of the muscles and contraction. So they can contract, they can expand. So we advise mothers not to put on anything tight at their waistline. Again, heavy dressing. Most of the time when a woman is expectant, you will always have a lot of sweat. You are not comfortable, you have funny hot flashes which are in, out. So once you start putting on very tight clothes, you will now aggravate the feeling because you are not having fresh air to go up. You have put very tight dress because you know nature, you cannot change nature. If it comes, it has come. You'll have to remove that sweater. You'll have to remove that tight dressing, especially putting a bangle of a belt on your abdomen when pregnant. Even if it's first trimester, it's not advisable. It can cause some small complications which you could not have got if only you followed the instructions. At second trimester, which starts at 34 weeks to 36, that is the time the vomiting is gone, the appetite has come back, the weight has started handling well, whereby we expect you hand at least half a kg have a kilogram every month, and you now start coming to the clinic at least once every month. If you are able to reach, that is the advice. We'll now be giving you the second injection of tetanus, because the first one we gave at the first visit, which should not be late, to help those who have had their first delivery. But if they have had other deliveries, the injection of tetanus will be given only once, because this mama created immunity with the previous injections was given with the previous pregnancies. So you'll only get one injection.
So these injections that they get in the second or third trimester?
If it is first pregnancy, you give in the first trimester as long as the mother has reached you. Why? Some might not manage to come back to the clinic, maybe due to other skirmishes. You can remember what did to us. So we always feel any mother who has come proven pregnant, it is good to give the TT, the injection. First pregnancy, you give 2 doses at an interval of 4 weeks. So if you give the first one when the pregnancy is about maybe 3 months, you have trained this mother, anything can happen and she will never come back, then you repeat the next one, the following one, after 4 weeks from that time. But if you have had first child, second, third, fifth, there are those some of us, we have even reached 10. If you have got 5 doses of TT, you don't need any other injection after you have delivered 5 babies, because those are already 5 injections. The rest, you can continue giving birth without any danger of your baby, because your body, the antigen has been given to you almost 5 times. So any mama who is having 5 children, attended clinics well, received the TT, thereafter they don't need an injection again. Their body has created enough immunity. So there's a treatment we call folic acid and sulfate. My clinician will maybe give anything that is very necessary during 3rd trimester. It is a must. We give it in clinics with no payment. Why do we give it? Folic acid is a very important tool to our bodies, especially the babies, because of formation of the bone of the skull and the spine. I am sure some of us, we have even Googled, we have seen a condition called encephaly. Encephaly is where a baby is born with only the skin of the scalp with no bones, and they tend to have a wound at the spinal cord. So folic acid is given at an early stage before 34 weeks and continues up to even 36 weeks, so that our baby can get enough strength of the bones. They may not form deformities. Others, I'm sure you have also Googled that you have seen hydrocephalus. Hydrocephalus is a deformity whereby the spinal fluid does not flow from the brain to the spine and back. Instead, it corrects inside the brain and the bone, and the brain cannot retain the amount of spinal fluid moving, so there's no that movement. So a mother, I know most of we mothers, we don't like taking drugs just because of the nausea we talked about in the 1st trimester. But I'll say this time that even if nobody has written for you to take folic while pregnant, you can even go to over the counter and ask for folic acid and start taking. It is not dangerous, but very helpful to your baby, the growth of your baby. So the other thing is rest in the 2nd trimester. If a baby is born before 37 weeks, that means it's a premature baby, has to be taken to nursery for further management. So we request that between 32 to 36 weeks, we have to have rest, at least 2 hours per day. Some of us we women, unajua kazi yetu ya wamama ni mingi ya ishangi, hata tukiwa tumelala, but we request every pregnant mother to create some time to rest. Resting does not mean you are lazy. I know we need a lot of time to look for food, to look for anything that we need in our homes, but while pregnant, you'll have to create some hours to rest, especially afternoons. Because morning, maybe you are doing 1, 2, 3. Why rest? When a pregnant mother is resting, the flow of the blood through the placenta helps this baby also to earn weight, and the food reaches the baby well. It's just like the way you also take a siesta after feeding. Si huwa unasikia mzuri ukikula na ulale kidogo. So the same with this baby who is in you. Also feels good, you are resting, and there's a good flow of blood to this baby. Also you yourself, sometimes we swell the feet, and the pressure is good, urine is good, but we swell the feet because of maybe standing so much, walking so much, and then at night you are not comfortable because your legs are swollen. Na kumbe wewe mwenyewe ndio hukutaka kupumzika wakati ya mchana.
Okay.
Nafikiri nikifika hapo nimemaliza second semester. And we now again continue giving. The return dates becomes a little bit faster, at least once a month or after every 3 weeks as we approach third trimester.
Okay, thank you so much for that. And there is a pressing question here. I think somebody may not be in our zone, in our time zone. There's somebody called Sophie Chago saying, can I have test tube babies? Waiting for answers before I sleep. So I think we'll start with that before we go far. So Daktari, start with that one. Then also maybe tell us also now about the health factors and risk factors that come with the second trimester.
Okay.
Okay, thank you.
I think it is a reality with the current and the modern science that right now we can have babies outside the womb, or we can even hire a womb that's not yours so that you can have a baby. So that depends with whatever we are treating, that or whatever happened until we reach that time that we had to make a declaration that this baby has to be born outside the normal environment of their own mother. And most of the time it's issues revolving around infertility that we talked about. Probably you have all it takes, but again you cannot carry a pregnancy. So we choose to use either a surrogate, yes, and get that baby off you and grow it aside you. That's what I think they refer to as most of the time test tube babies. Just to also highlight on the second trimester in terms of challenges that come up or other complications that come up with it. At that point we are entering almost a safe zone when it comes to pregnancy. And for us, just like you say, we are monitoring on any other thing that would want to come out. Like we had mentioned in the first trimester, we want to screen this mother of some chronic conditions and also some infections. That is why we did those basic tests, because we know there are common conditions that would really affect the growth of the baby. And if that is already taken care of, right now, what will be very keen for us during the second trimester is if we previously we found out that the mother is having a chronic condition, either diabetes, hypertension, which are the most common during that time. For those who have already either earlier diagnosed hypertension or earlier diagnosed diabetes, then we'd want to manage those conditions. So those are medical conditions, and we just manage them medically. So if it means putting them on drugs, antihypertensives, we put them, we maintain the right doses. We do spontaneous checks or even program checks on how they are coping up with the treatment of the condition and how the pregnancy is faring on during that time. If we are managing all those medical conditions, be it epilepsy in pregnancy, diabetes in pregnancy, or hypertension in pregnancy, it means the physician or the clinician becomes a friend to the mother. It is not just a clinic where the mother just comes and takes her vital signs and maybe be given a shot for prevention of 1 or 2, 3 things, but again has to get a review of how she's coping with the pregnancy with that chronic condition. Another thing that would happen, between the first trimester, we are expecting any form of abortion to take part during that time. And still at almost 16 to 20 weeks, we still expect also some kind of an abortion to take place. If at all the mother's uterus is not strong enough to hold the weight, because you've had now, sisters just say that at that time we're expecting now the load to grow. We're expecting now the cargo to grow in size. So it means we also have to check on the patency of the uterus and the carrier, whether they can hold on that weight. There are some women who cannot take care of that weight. At 16 to 20 weeks, they just give the uterus gives into that weight, and the baby comes out, and the fetus comes out. So during that time, we would see instances where women complain that when mimi nikifika tu kama 16 weeks lazima mtoto atoke. Then that would be a sign of what we call an habitual abortion. And most of the time, they become a friend to the gynecologist at that time. And we do the necessary referrals so that they are prepared for a bit of a surgical procedure to make sure that the uterus can hold that weight until a certain time again, that we can open up the uterus so that we can give the baby easy time to come out. So those are some of the things that just maneuver or just revolve around the second trimester. So we are managing conditions if there are any chronic conditions. We are managing any kind of infections that would want to come up. And if some of them would still want to go on with, I think the most common thing is that issue of either vomiting and all that. If somebody would still want to go throughout, would want to introduce some antiemetics, but at levels, so that we control whether she still has that feeling of nausea, not wanting to feed, spitting too much, and all that. So basically that.
Okay.
Yeah.
Thank you so much for that. And this is actually a very interesting conversation. I'm seeing very interesting comment, very interesting feedback from you. At this particular moment, I would just want to promise you that also today we have a cake with us on the table. I'm sure my director will be able to show it to you in a few seconds. So actually, if you are watching the show and you're engaging the show, you have a chance of winning a cake courtesy of Redroyal Cake House. Redroyal Cake House is situated in Eldoret at a place called Eden Center. Eden Center is just behind Comfy Hotel. But remember that as much as the bakery or the bakers are located in Eldoret, then you can always get the cake even far away from Eldoret. The whole North Rift, ukitaka keki, consider working with Redroyal Cake House. And I think it's on your screens right now. So the cake you are looking at on your screens right now is a cake that was baked by Redroyal Cake House just for one of you. So the more you engage the show, the more you talk to us, the more you talk to the doctors, the better your chances of winning a cake courtesy of Redroyal. At this time also, I would just want to also announce that last week, Milimani Hospital had given us a few gifts, and I would want to give out one today. So if you know of anyone who needs to undergo a scan, it's called ultrasound. Mtu yote ambaye labda unafikiria labda unatarajia mtoto and you need to go through ultrasound, then tag them there and tell me the reason why you feel I should award them that particular chance to get an ultrasound at IVC Milimani Hospital. So make sure unaingia pale kwa comments. If you feel there is anybody, or if you are there and you need to undergo an ultrasound, uko pale kwa comments, you're watching at the moment, or there is somebody whom you know, then talk to me right now in the comments. I'll choose the best comments. So I'm saying that IVC Milimani Hospital is giving us, I'm giving out one chance. Of course, we have several gifts, but today I would want to give out one ultrasound, a chance to have ultrasound at IVC Milimani Hospital. So what I just want you to do is ingia hapo kwa comment section. Tell me, if it is you, tell me why you deserve. If it's somebody else, tell me why they deserve that particular chance. By evening, I'll have chosen one person and we'll communicate over how they can get that ultrasound courtesy of IVC Milimani Hospital. IVC Milimani Hospital is situated within Eldoret, actually a few kilometers away from the town, but then in a very accessible area. So I'll be able also to share the location later. Last week, our experts share their contacts, and I hope you reach out to them about different issues about also reproductive health. Before we go far, work the like button, hit that like button. Let me know that you're watching. Ningependa kuona zikitembea tembea hivi, nijue kwamba bado niko na watu, because anytime you hit it, actually it goes up with your profile, and I'm able to know who is actually still watching the broadcast actively. So skuma your like button kabisa, ifinye kabisa mpaka nijue uko maeneo na unasikiza. Before maybe I come back now to, actually we're coming to the final quarter of this particular broadcast, and we're looking at the third trimester. Before we go to the third trimester, let me just sample some of your comments, then I'll allow Salome to take us through the third trimester. Then Kevin now will talk about the conditions that may come up during the third trimester. Also, just consider also maybe talking to us if you have any questions about about the third trimester. Also, remember that next week we'll be talking about delivery day. What are the things you need to do right during delivery? What happens in the delivery room? And then the next week we'll be tackling postpartum. That is how to handle a mother and a baby after the baby has been born. So make sure that also you keep it with us. Every Wednesday we are here talking about health. From Monday to Friday we are here talking about different aspects of living. Just to sample a few comments, kuna zile naweza nikaruka, lakini feel at home, furahia, because actually you've seen them, and I'll also be able to engage with you in the comments when this particular broadcast has come to an end. So let me just talk to a few people here. Vivian Jerob saying Sugari thinks iko sawa. Excuse me, I don't know what is happening. Anyway, Kim Slavin saying what can one do to get pregnant after she used the 3 months family planning? Okay. Then there is a Bethuel Kiplagat Bed saying Kim Slavin, hii umesikia ama? Okay, I think there is a conversation going on in the comment section. There is Rehema Kiteko. Unasikia? Okay, I think people are having conversations down there. It's very good. I'm seeing Mildred Zoom saying the show is wonderful. Thanks so much for this great topic. Thank you so much. Nedi Jeruta Kipta, all the way from Elgeyo Marakwet, actually saying that thank you so much, Dr. Salome, for your professional practitioner. What you're talking about was seriously taken into consideration some years ago. But as now, women go through, they are literate and are very arrogant about the first trimester clinic visits, which is very key in the survival of the fetus. It's high time that the county government should have sensitization campaigns, antenatal clinics in any gathering to minimize the percentage of stillbirths, and utilize of Linda Mama free health cover insurance provision to the pregnant mothers. Otherwise, congratulations, the show is lit. Kevin, what are the causes of backache? Many women do complain about this in most cases. I think thank you so much for that. For those who don't know Nedi actually is a very influential person in Elgeyo Marakwet County. I think she was in the last county assembly. I'm not sure if she's in the current one. She was actually I think you'll tell us much about that, and I'll actually call you also on Tuesday. One of these Tuesday we talk about matters, politics and all that, but she was actually in the last county assembly for the Elgeyo Marakwet County. I'm also sure that right now there's a position she holds. I'm not sure of it. Maybe unaweza tuambia hapo kwa comment section. So we'd work with you also even in your community to make sure that we bring these services to the people. I'm sure IVC Milimani also would want to get some clients from Elgeyo Marakwet. As much as they are in Wasingishu, we can come there for a few programs to just empower our communities better. So thank you so much for always being part of this particular broadcast. Thanks MC Kali and Redroyal and the photographer. Okay, that is Kim Slavin. Jana alikuwa mshindi wa keki. Any other person? Lois will skip Tum saying thanks so much. Notes well taken. Chebleting Beril saying I'm back. And Lee Maritim anasema lazima mtu akuwe na ball. Okay, ndio apate hiyo zawadi. Okay, yeah, because we are talking about reproductive health, of course. Siwezi kukufanyia tu ultrasound. Yeah. Okay, I know the ultrasound for other things, but then in this case we want to award somebody. I'm sure Dr. will also guide on that. We would want to award somebody who maybe is already going through the pregnancy journey and would want to get an ultrasound. I'm sure maybe when we'll be talking about other things, we can expand and consider other people who may not be pregnant for that particular present. But today, nipatieni mtu mmoja. By the way, I'm not seeing those comments. I nominate somebody to get that ultrasound today because lazima nipeane moja siku ya leo. Thank you so much for the viewership. I'll be going back to Daktari now. I think we had finished with Daktari. And there's just one question about what is causing backaches and all that. Then we'll go to Madam Salome. So maybe Daktari, to deal na hilo swali la backache ambayo imeulizwa na Nedi kuhusiana na mgongo kuuma kwa kina mama wakati huo wanabeba mtoto.
Okay. I think the cause of the pain is majorly anatomical because now changes are occurring. The baby is growing and it means it's more weight, more room. And you see that back, or the physical structure of the body is being supported by that skeleton, the skeleton structure. So if all this time around you have not been having this kind of weight all around you every time, and this time now there is something that is growing and it depends on just that skeletal structure to support it, then it means it will bring in some deficit. So whatever is happening at the back is trying to adjust its muscles, tendons, and also the spinal structure to accommodate the weight of the fetus that is coming up. So those are changes that are revolving around what we call the muscular and skeletal region. And it's because it wants to actually contain or carry the weight that is coming because of the baby. So most of the time that pain is just because we are trying to adjust. We also don't want it to be severe. If at all it goes to a place where it's really becoming, it gives you uncomfortability of, let's say, recognizable nature, then, or disturbing, it makes you not to do any other thing, then it would warrant more investigation. So that we just look at the pregnancy, we look at the musculoskeletal structures there, and make sure that everything is okay. Probably there was injury or there was trauma, and it needs to be taken care of, apart just from whatever is going on normally. So that is how we would want to take care of it. We just look at the severity, and depending on the severity, it will warrant either more investigation, or we just take it as it is. It is the fetus growing, causing the excessive weight demands that are put on the mother, and we want to take care of that. Yes.
Okay. Thank you so much for that. Daktari is saying that unless it is actually straining you to an extent that you cannot do anything else, it is nothing to worry you much. I'd be going back to Salome. She would take us through the third trimester now. What are the changes you expect? How do you know you're still okay? And all that. I know there's a lot of anxiety in the third trimester. So Salome, it's your time.
Thanks again. Welcome to the third session of our antenatal care. That is third trimester. We have talked so much about ultrasound. Maybe at this point, I would like to say that it's good to do an ultrasound. Let's not look at it as we are wasting money, because as I talked of complications of second trimester, it will help us know, you and I as a clinician or as a midwife, to know whether your baby has any deformity. So it is important to do an ultrasound at first, second, and third. I know many mothers have been fearing that mtoto wangu hawezi kupigwa picha, while this is just a spot. It's just like a spotlight. The way you take your own torch, umulike, uone mahali iko dark, what could be there. So ultrasound does not have any effect on our fetus we are carrying, on our babies. So let's not fear to do an ultrasound. It is very important. It gives us a lot of information about where the placenta is situated, whether your child might be having any deformity, whether the cord is too long, because sometimes we get accidents of the babies in the uterus where the cord goes around the neck and we find we have lost this baby inside the utero. Ultrasounds are very important. Please, let's do them. Even if it is in every trimester, first, second, and third, it has no harm. Actually, it is helping you and I even to know the sex of your baby if you want to know. If you want a boy and girl, before delivery, you'll be having a hope of what the type of the baby you are carrying. Is it a sex of a baby? Which sex of the baby? It will help us in very many things. Not only looking at the sign of the baby, also the mother could be having other complications, like enlargement of the spleen, any problem within the kidneys. It can help us, and then we shall know how to care for those babies, for you as a mother and the baby. Third trimester is a very crucial period of a mother. A mother has started becoming very tired, as we have asked my colleague Kevin here about the backache. The backache becomes worse because of the weight of the baby. Here you are curved, your spinal cord is curved because of the front weight. So you need a lot of rest, and almost every community in a family, in a village, wherever you are moving, will always help a pregnant mother who has reached third trimester. Kwa mfano, muko kwa gari, mama mjamzito, kweli kijana mdogo huwezi kaa kwa kiketi, badala ya kupea huyo mama mahali ya kupumzika, because her backache is stretched. She needs where she can support herself. The ligaments, we call them ligaments because of change of hormones, they become weak. So you find that it's like a spring. Our back works like a spring, whereby it will go up and down. So during that movement, that's why that backache will be worse. But our clinician has said, you come and then we expect to check whether there would be any other injury apart from the body weight and the hormonal changes. Third trimester, there are some drugs which are specific. You cannot take when you are almost giving birth. This time now we are talking from, you are now 37 weeks and above. And the maximum weeks we give to a pregnant mother in to reach that trimester is 37 to 41 weeks. If by 41 weeks you'll not have gone into labor, you'll have to report, and the subsequent visits are normally very close. Can be even after 1 week, 2 weeks, depending on the condition of this mama and the presentation of the baby. This time we are expecting the head of the baby is downwards, but not up. When they come, we know we want the head to be down, because below the umbilicus. Down means below the umbilicus, chini ya kitovu. Tukikupima tunaona kichwa ya mtoto iko chini ya kitovu, lakini si upande ya juu. Hiyo ni sign mzuri, so that when you go in labor, we are sure of a normal delivery. But if there will be anything abnormal, we shall have told you from the beginning of first semester. There are some drugs, for example, drugs which contain aspirin. Aspirin itself, brufen, diclofenac, which are on the market today. They are little bit dangerous drugs to swallow, and many mothers engage taking them because of the backache. That backache, even if you take that painkiller, it will not go. But these drugs, they are not very good to the baby. They can affect your baby at the junction of the heart, the lungs, and the heart, because they have some components of making the blood to be a little bit thin, so bleeding can occur. So unless it is very crucial, is when those drugs we can take. Okay, antibiotics, they have no problem, but remember, UTI, unless you have any serious serious signs and symptoms, is when we can give you. But as we said, UTI will always be there in a mother, and that is why when you see, when we come to delivery, we should talk about it next week. Your baby is given some syrup to take. It's just because njia yetu ya uzazi, our birth canal is always not very clean. So when these babies come out, they sweep the water together with that canal, and then because we wouldn't like this baby to get infections, especially the commonest is conjunctivitis. Macho inashikana, inatoa uza kidogo, inashikana. Na a mother wonders why that child is sick and has not been in the dust. Kumbe ni njia yetu ya uzazi. So anything that is alarming, during third trimester, we try to correct it early. Actually, third trimester is rest and taking care of yourself in hygiene. Start looking for your ways of preparing to go for delivery, how you leave your home, because sometimes we have come across mothers wanakuja wanakuambia, mimi sitarara hapa, niliwacha sinjafungia kuku zangu. So this is the time we need to start preparing ourselves, in that when the day of labor comes, you are a little bit settled in mind. Because if your mind is psychologically tortured, it can also affect the onset of labor, because you are not relaxed and maybe there's something disturbing. So sometimes it can disturb. So we want that stage of labor, the mother to prepare, accept to rest and harvest this baby. The other thing which is very crucial before I finish up with that stage is onset of labor. Onset of labor, some mothers can start by pouring water with no pain. You have to report to hospital immediately. You don't wait for the pain. All this happens in third trimester without any labor pains. Why do you need to go very fast to the hospital? If the water bursts, there's a tendency of the cord dropping, and once it has dropped outside the uterus to the birth canal, the hand of the baby, or we call it the presenting part, can press the cord and you lose the baby that moment. So it is that serious. Any waters which can break before the onset of labor, the pains of labor starts, you go to hospital. Any sign of bleeding, you report to hospital. That time you don't even mind so much about the age of the baby, because the baby has attained that 7 weeks. If it is born, it is in safe hands, up to 41 weeks. After 41 weeks, if there is no pain, please come to the hospital so that we can do another ultrasound, see how active your baby is, because now the placenta is growing old and is not able to feed the baby. We have to do what we call induction of labor. And before closing this session, maybe I would like we scan this, the signs.
I think my director can get that kindly.
We need to scan these signs you report during your pregnancy. There are quite a number, and this is our book. This is a book that we use. You'll have it at home, whether it is in private, whether it is in government hospital. We are using same antenatal care book. So all these signs, there are quite a number. There are many. Pouring water before the days have reached, bleeding, having a very severe headache, swelling of the feet, having convulsions, yani unaanguka kama kivava na we uko na mimba, is very dangerous. That one actually you need to look for an ambulance. to be reached the hospital as fast as possible. So we have drawn them in this book so that they can alert you at any time you are at home and you are able to take action as early as possible. And this booklet carries all the information of how to care for yourself as a mother at home before delivery and after delivery. And we call it a legal document. Why a legal document? It has all the necessary things for your baby when the baby will be born. You have to take this child to the clinic. The weight for the baby is drawn here. So you should be able to keep it well till this baby you have given birth to reaches 18 years as an ID card, an identity card. So this is a legal document. If you as a mother, you don't do exactly what is expected in this book. For example, you never took your child to get a polio vaccine. Here is your son, your daughter gets polio. That child is asked a way to report you that you never took me to the hospital and I got polio. So it is a legal document. We expect it to be kept well. It can help each of us. Even when you want to go to other countries, they need this book so that they see that you are given all the vaccines which were necessary after delivery. Otherwise, fetal movements of the baby third trimester is very important. Lazima usikilize mtoto anacheza kwa tumbo. Ukiwa utaona kama mtoto achezi vizuri, we have this gadget, it is called a fetoscope. Kazi yake ni kusikiliza mtoto kama roho inapiga. And as it is beating, we count the beats using our watch. And if the beats of the baby has not reached 130 to 145, 46, maybe the baby is getting tired, especially during labor time. But even during antenatal care, we always count the beats so that we know this baby is well. If the beats are not very good, it can give you a sign of there's something wrong with the baby, so you have to do a scanning. If, as we are touching your abdomen, check, is it becoming too large compared to the months? Is it too tight? We might know that, have a knowledge that something wrong with amniotic fluid. Amniotic fluid ni maji yenye mtoto wako ndani. Ikipungua hapana mzuri, na ikiwa mingi inaweza onyesha there's something wrong with the fetus, because naturally the fetus drinks the amniotic fluid and to settle it during fetal period. And that is why you see when a baby is born, immediately knows how to suck. They start sucking while they are inside, and that will help us even before the scanning. As I'm a known midwife, before the scanning came, the machines came, we used to know with our own hands that this abdomen is not good. The parts of the baby is not good. The amniotic fluid is too much. So we'll know the baby inside there is not sucking the fluid. There's something wrong with that baby. And as I close, I request all mothers, please come over to the clinic once you suspect that you are pregnant. We are there to help you. Also, be close to your neighbor as your first doctor, wherever you live.
Okay, thank you. Actually, umemaliza mbio sana, expected. So maybe I'll also give you a chance. I know last week you gave out your number and the location of the hospital. I'll give you a chance to say that once again, and anything else that you may want to say in your closing remarks.
We have come to the end of third trimester. We are now expecting the mother to report to us in the hospital at any time. Our location for our hospital is very near the highway. It is near a village in Eldoret called Mailine, on the way to Uganda Road. And it is situated only about 1.5 kilometers from the highway. It's less than 2 kilometers. And we are mission centered. It's a mission hospital. So when you come there, you are a Christian. We expect you will cooperate with us, and we will do our best. Our charges are not much. My clinician here will help to give more details on what is expected this week. And there is midwives. We are ready to receive you at any time. My number, if anyone needs comments or requests, is 0721 774804. And thank you for listening to me. I cannot exhaust everything. Every mother comes depending on her condition. Thank you.
Okay, thank you so much. Maybe I can repeat Senior Salome's number, 0721 774804. That's right. Okay, thank you. Before we come to the end of this particular broadcast, of course, Kevin will get a chance to maybe finish up also on what he has about the third trimester and the presentations and the different challenges that may come up there. I just want to also tell you that maybe I'm seeing people nominating each other on the comment section. I may not give I'm seeing a lot of nominations. I'll go through those nominations for the ultrasound, and I think by the time tunamaliza jioni leo, we know will be going to IVC Milimani Hospital to get that particular test. Then there are a few questions that came up that I would want Daktari to just reply to them as part of his closing remarks. So reminder, I'm waiting for you. Okay, there's somebody. Okay. Hey, mtu ameuliza swali mpaka amenipiga reminder. Give the family history. Are there genetics tests that you should think that you think one should have before the pregnancy or when they are pregnant? Is there a need for any digging family history or genetics before that? You'd also reply to that. I think there's somebody who's been asking that a lot. And then there was also a question about there was a question about what? I think I'll get that before the end of the show. But then in the meantime, Daktari, you could be giving us there's somebody. There's actually something about either C-section or a normal birth canal, whether you can just prefer to take the C-section without necessarily having health issues and all that. We'll cover that next week much, but then because the question is also coming up, I'll let Daktari talk about it. So in part of your parting shot, give us something about the CS and normal birth, and then also there is something about the family, the genetics and all that. Thank you.
Okay. Thank you very much for this opportunity. The very nice media, Dowie Afrique, who are back there directing the show for us. Brilliantly doing very good shows for us as we watch these things back there and review them. This is excellent job. If we can have this continue, then we have done part of what we call health promotion, where we just need our population to know what challenges they face out there, and they're able to actually mitigate on them before they get to the hospital. Actually reducing on the medical burden that we have within our structures of managing medical conditions. So back to what we were talking about the final trimester. We are technically, as clinicians, we are technically managing conditions that are traveling along the pregnancy. You're having diabetes, I said we are controlling it. We are using drugs, we are using either the dietary approach or we are using both to make sure the diabetes is taken care of. You're having hypertension. Why are we circulating around hypertension every time? Because it gives us that crazy condition called preeclampsia. Those high BPs during pregnancy that would even cause you to even have convulsion, would cause a mother to even have convulsions. And we really want to control that. And the best way to do that for us is we pray that the pregnancy is now mature enough to survive on itself, and make sure we remove the fetus before even it gets to term. because we don't, what is actually making that hypertension go up, it is just that what is aggravating is the hormonal changes. And if we get the fetus out, then it would mean that we will take care of that pressure. So preeclampsia is one of those conditions that would really want to take care of during that time, and that is why we are ever on that BP for that particular mother. Some other thing that would want to appear during this time, during that last trimester, and you see it being taken care of by that clinical toolkit that we have to look at every visit, is this: the presentation of the baby. We want to look at how the baby is coming. We want the baby out head first. And that we can tell clinically when they do the assessments. We want to know the position of the baby. However, if we do the examination and find out the baby is not coming in head first, then we make recommendation. So at third trimester, that is the point where we are making the decision whether this mother will have a Caesar, commonly known as a CS or a cesarean section, and as another mode of delivery. So we are making choice of how this mother is going to deliver. We are making it then. Because depending on the medical condition, depending on the presentation of the baby, we want to make a decision how we are going to receive this baby. Through theater or through what we call spontaneous vaginal delivery, just coming out in the normal way. So for us, we are just looking at those dangers that would come or revolve around a safe delivery. So if you cannot have the fetus come the normal way, then the other way is just a cesarean section. Depending with our cultural upbringing, most people just take delivery is taken differently from various groups and families and all that, because there are some people who just choose to have CS just because they fear the act of spontaneous vaginal delivery. Yes. So for us, we just want to journey with the patient, and whatever the patient is comfortable with, he will have the benefit of proper medical advice, so that we just give them the black and white of what is out there. There is a cesarean section, which is most of the time to manage complications that would warrant either raise a risk of maternal or fetal death, and would want to control that. So we go into that, we make a decision on doing a cesarean section, or just advise that the journey was good, and the baby can come out spontaneously through the vagina. But also the choice is also laid to the mother and the family, or rather the couple, to decide. Some of them, the fear is too much, and they would want to have what you call an elective Caesar, where we just make a choice that they will just deliver, not because there's any complication or anything, but they would rather be knocked out before the delivery. So as a final take, talking about family history is very important in any medical aspect, because some of these conditions that affect even pregnancy would even rise from what happened through their family line. Diabetes as a condition is something that can be linked to genetics. Hypertension can be linked to genetics. So those are things that we have to look at. And an advice out there, as you have been told where to find us, sisi ni watu tuko pale Mailine. Mailine, unapanda gari ya Mailine, unasema unashuka Kinyozi. Kufika hiyo stage ya Kinyozi, unaangalia kibao inakuelekeza hiyo 1.5 km ukielekea mlima pale inaitwa IVC Prayer Center. Most people have interacted with that facility. That is where the IVC Milimani Mission Hospital iko. So hapo utatupata na tutakupatia hizo services. But as your journey to walk there begins, or you want to interact with our services, it's also important to note to the couples that this last bit is where the husband and the wife need to be very close. It's unfortunate because from where you come from, you disappear from the home at this time. This is when you disappear and go away. And you want to come back, saa ile umeshatumana mama amejifungua ameenda kukaa tena kwa miezi 6. But this is the time where you are needed as a man, because your back pain inasaidiwa by simple massages, kumpampa kidogo, kumwandikia msichana wa kazi kwe kidogo pale kwa nyumba, and all that. You see, those are just home economics intervention so that you can do, so that you make sure we release and or relieve the burden on the mother, so that they can have what is called a strong delivery, or the psyche is up ready for delivery. And a last thing for you, Kalia, during this strategy, during this trimester, I would give you a very simple strategy. The opening of the cervix need to be ripe, yes, so that it opens up well during delivery. And instead of you coming to pay us so that we can help your woman deliver because we want to ripen the cervix, you can do that on your own. Because sex is very good during this last trimester. Because your semen provides...
Actually, people are asking that so much. So yes. I think you're now concentrating on that bit.
Yes.
Somebody was asking
sex for you, Kalia, there is a must. If it can happen, let it happen. If it poses no medical condition, then it has to continue because your semen will introduce prostaglandin on the cervix and the cervix will start ripening. So by the time sister is meeting with this lady, the cervix is already ready to open. So thank you very much, Kalia, for this opportunity. That is advice that you can cut away and use it on various forums. Thank you very much.
Daktari rightly there, finishing it on a light note, but a very serious one also. Okay, thank you so much, Ole is watching the morning glory. This is the Healthy, Wealthy, Wise edition coming to an end. But then before we go there, as usual, I've always told you that tunasema mcheza kwao utuzwa. And today we have a very yellow cake, a very lovely one, going out to one fan. Now, by the way, today we have two cakes. Yesterday, I promised that we'll have a cake today for the fans. So the cake actually was bought by yesterday's visitor. That was Dan. So kuna wenye walishinda keki mbili jana na pia leo kuna keki mbili zinapeanwa. So this one we are giving it out to an individual who will choose their friends and bring them wakuja wakule. But then there is another one that I'll nominate a few people. I'll put their names up on our pages. That is the We Are Freak page and Very Nice Media page. And we will invite you here today in the afternoon, if you'll make it, tuweze kukata hiyo keki. So this one that is appearing right now on your screens ni ya mtu mmoja. Remember that the cake is being given to us by Redroyal Cake House. As I told you, Redroyal Cake House is serving the whole of North Rift when it comes to cakes for various ceremonies. I think nowadays cake inaenda na sherehe. So make sure that whenever you need a cake, you talk to Redroyal Cake House. So today we've had quite some nice engagement. I would want to thank everyone who's watched the show. We've had, just to mention and go through it very quickly, wale walikuwa, we had Nedi Kipto, thank you so much. We had Bethuel Kiplagat Bet, we had T-Rop, we had Kim Slavin, we had Kevin Otieno, we had Rob Kipto, Alex, we have Chepleting Birir, Lee Maritim. We've had so many of you. We had Vivian, we had Mildred Sum, we had Glam Watch, Pala watching, and so many other of you. I may not mention everyone. We had with us Ellie Rotich. Thank you so much, Ellie, for being there. Queen She was there with us. There was Caroline Chepkulgay saying the show is very educative. Tune in from Nairobi. Thank you so much. Kimuge Portraits actually asked a question. I don't know. Maybe we'll be able to answer this in the comment section. Daktari, what are some of the foods that a pregnant mother should avoid? What kinds of food are encouraged? Very knowledgeable panel following from Nairobi. Kimuge, your question will be tackled. I'll make sure that Daktari anaona your comment na aweze kukureplyia pale. Caroline Chepkulgay, thank you so much. Kimboy Arap Yosefu, thank you so much. Nyar Adekwo, hey, ngoja pole. Take me slow now. Anaitwa Nyar Adekwabo Kwermula. Hey, Jesus. Anasema tuned in, very educative session. Thank you so much. What a name. There is Mary Chiri saying good morning. Tuned in from Nandi. Thank you so much. I think we had answered this question by Queen She. She was asking about the blood group. Then I think I had read all of these. So thank you so much. Kosgei Arap Chesir, that is our director. Thank you so much for also making time always to be with us. As usual, then there is always a person who walks away with the cake and another one that waits to win in the future. So nispokutaja leo, it doesn't mean you'll not get the cake tomorrow. So today, based on FB insights, okay, I'll use also the FB insights, but then also I usually use I would say terms and conditions apply. Then there are people whom we deemed eligible to win today's cake. So today's cake, the one appearing right now on the screen, goes to Bethuel Kiplagat Bet. and he is the winner for today's cake. The one that came second was Bonnie Kim, of course. Then there was Chebet Birir, Chebleting Birir or Chebet Birir. There was something. Let me just check that right. So that nisikuita jina sio lako. There is somebody called who? Let me just get that right. Chepleting Birir, yeah, Chepleting Birir, not Chebet, Chepleting Birir. But Chepleting Birir, I think amekuwa hapa na sisi, ameonja hii keki yetu. So I'll also just maybe asking her aendelee hivyo hivyo, and very soon pia yeye ataweza kupata keki yake. But then today the cake goes out to Bethwell Kiplagat Bet. I'll also nominate a few of you. There is a cake specifically for fans that nakuwa napeana baadaye. I'll nominate a few of you around 10 tukuje tukate keki jioni na tuweze kufurahia. Yesterday we nominated I think there was Lee Maritim, there was Queen She, and somebody else. I think also Ronnie. There is somebody called Ronnie Rope Alex. Rope Alex also will be part of those who will be coming to cut ile keki ya community leo. But for Bethwell, get a few friends na upitie leo uweze kupata keki. Also later, we'll be looking at your comments and those you've nominated, and we'll give somebody a complimentary ultrasound at IVC Milimani Hospital. Remember, at the end of this series, we'll also be giving one person free delivery slot. So tukiendelea kufuata hizi series, I think we still have around 3 series. So make sure that you also part of us. People have been asking so many questions about the rhesus factor. Next week, we are talking about delivery day. What happens during delivery day? But then we'll be sure to start with the issues of rhesus factor. We'll dwell in it. We'll give it some good time. And then also we'll deal about the issue of CS against normal birth. Daktari has touched on it, but I still feel there's a lot of questions coming in about that. So as we prepare for next week's show to talk about delivery, we shall also mention something about the CS and then also the rhesus factor. Away from that, remember we've been coming live from Dawi Afrique Photography. As usual, I've always promised you that Dawi Afrique Photography is the best production house in Eldoret. They are the best currently. So make sure that anytime you need anyone, anyone to document your work, make sure you work with Dawi Afrique Photography. Remember, they also have a safaris branch. So if you'll be having tours anytime soon, remember to talk to Dawi Afrique Photography. With that, my name is MC Kalia. Until tomorrow, see you.